Good morning. My name is Rui Abreu. I'm a nephrology resident from Portugal. And my presentation is about the value of preoperative ultrasound mapping in native arteriovenous fistulas for hemodialysis patients in elderly patients. So, as we know, the approach of vascular access has been changed after the creation of the introduction of Doppler ultrasound, and we know also that integrity of vessels are usually compromised in the specific population, like the older patients. So the aim of our study was to analyze the survival of native arteriovenous fistulas, and also the early failure, and also to determine the factors of prediction to both of outcomes. So our methodology was this. We made a prospective study with 5 years of follow-up, and we included older patients with age superior to 65 years, with a placement of a native arteriovenous fistula between January of 2011 and December 2015, and all of them have been submitted to a preoperative ultrasound mapping. So about the data that we have collected, we collected demographic data, clinical and laboratorial information, and finally ultrasound measures like diameter of the vessels, the hemodynamic of distal vessels, measured with the peak of systolic velocity in both radial and ulnar arteries, and finally the resistance index. So the baseline characteristics of our sample was this. We have 60 patients with the inclusion criteria. The median age was of 75 years old, and the male patients were male. We can see that our sample have some comorbidity with a score of Charlson median value of 7. And talking about the laboratorial data, the values were adequate to this kind of population. About the measures of ultrasounds in preoperative mapping, we can see that the median values of diameter of the artery have a measure of 2.2 millimeters. The vein had values of 2.4 millimeters, and both PSV of both radial and ulnar arteries have median values superior to 60 centimeters per second. And about the resistance index, we can see that the median value was of 0.8. About the results related to predictors of survival, of secondary survival, we can see that there was no differences talking about the clinical data and laboratorial data between the both groups. The only difference that we had searched was about the hemodynamic distals of preoperative mapping in PSV of radial artery and ulnar artery. You can see that higher values were more associated to better outcomes, to longer survival of arteriovenous fistula. In the next table, we have the same analysis, but to the different outcome, to the early failure. And in univariate analysis, we can see that, again, to the clinical and laboratorial data, we didn't find any differences. But talking about, again, the mapping, it's had done some predictable information about the diameter of the vein. We can see that smaller veins were more probably to fail in the first month, and also the lower values of PSV in the radial artery also predicts a worse outcome. Talking about the secondary patency of the arteriovenous fistula, we can see that at final follow-up at 5 years, we have good results to this kind of population, with secondary patency rate of more than 60%, which is very good to the elderly patients. So about the conclusions, we can say that Doppler ultrasound probably had some responsibility for good patency rates, and also the distal AVF predominance in these patients. We can see that distal hemodynamic and vein diameter showed some predictable value in secondary patency and early AVF failure. So with increasing aging with multiple comorbidities, probably could justify a systematic preoperative US mapping in our patients. And that's all. Thank you very much.